Okay. It's starting right now. Okay, we are live. All right, hello everyone. We are Kentuckians for Single Payer Healthcare, and today we are discussing the Medicare Advantage plans at today's Journal Club. My name is Sarah Parker.
My name is Kay Tillo.
Antonio Wilson.
Charlie Casper.
Peter Ash.
Jill Harmer.
Gilman Baga. Antonio Wycliffe.
Larry Camp.
Doris Spencer.
Christine Perlin.
And today we are talking about the article that was featured in the December 1st New York Times called "The Trump Administration Peppers Inboxes with Plugs for Private Medicare Plans." So basically this article was about how prior to the deadline for Medicare open enrollment, the CMS, the Center for Medicare and Medicaid Services, sent out emails to seniors talking about the benefits of Medicare Advantage and why they should sign up. And they didn't really talk about any of the good or the bad or any of the bad aspects of a single pay of Medicare Advantage. It just kind of put out the why they should sign up. So did anyone have any thoughts about just the article itself? We will talk about the what Medicare Advantage is, because I honestly, prior to 2018, I don't think I really knew what Medicare Advantage was at all, because I'm 22, so I don't really, I knew about Medicare, but I didn't really know about Medicare Advantage. So does anyone have any thoughts on the article itself? No?
Well, I turned 65 this year, and I don't know where they got my phone number,
Really?
but I was getting phone calls from all different organizations trying to sell me Medicare Advantage plans.
Wow. Does anybody else have a similar experience with Medicare Advantage?
I generally don't answer the cell phone. To me, if it's important to leave a message on my voicemail, but I would safely assume that is somebody trying to hawk some junk.
That's true. But
namely Medicare Advantage or some supplemental plan, which is BS.
Harriet, do you have any experience with Medicare Advantage trying to get a hold of you?
Well, it shows up on my email all the time. And just recently, it was check out Medicare Advantage programs in your neighborhood, within your zip code area. So somebody's, putting it out like an ad, I guess. And I'm not sure I've had anything from CMS.
Okay.
I had Medicare Advantage last year, and I'm looking at where it says about when it sounds too good to be true. I did not have any copays. However, I did have a deductible. There was a cap that deductible I had to reach before I didn't have to pay out of pocket. And there's no out of pocket. No, that didn't exist. Now, but this year I'm on PPO. So,
Can you say what is PPO? Does anyone else know?
Preferred provider
Organization.
option
Versus an HMO.
versus
Oh,
an HMO.
okay.
Yeah.
So there's more choice of healthcare providers
Yeah.
through a PPO, I think,
Okay.
than an HMO.
It's a bigger network.
a longer
Okay.
list.
But it's still a narrow network, or narrower.
no, it's not narrow.
HMO is narrower.
Narrow than general
And
Medicare
PPO,
care.
I think.
Yeah,
Well,
but
they're just organized differently.
Okay.
A PPO could be 2 people. Just
Yeah.
how many people you signed up. Traditionally, the insurance companies have tried to sign up a large variety of doctors so that they have an attractive plan. If you look and your doctor's on there, it sounds good to me. So usually they're wider than an HMO, but it just depends how that one is organized. I got out of the article, part of the article obviously was should they be promoting a private
Mm-hmm.
option? People I deal with, Medicare patients mainly, they're confused. There's too many options. They don't know, people are not sure what to do. So this is probably effective advertising. It gets people swayed or gets,
Oh, yeah.
changes things. And, the tone was there to be presented neutrally, if at all.
No, and of course, the way they're set up is that for many of those privatized Medicare Advantage plans, you don't have to pay a monthly premium. And for low-income seniors, which most everybody is, that's a big incentive to go into that plan, which costs the government more and narrows your choices of care.
So in the article, oh, go ahead, Harriet.
Well, have they talked about the range of deductibles? Have we heard of any really high deductibles in an Advantage plan?
Does anybody know? I don't know.
No.
Antonio, would you consider that you have a high deductible in your Advantage plan?
No, I didn't.
You did not. Okay. And this new PPO, is it also part of a Medicare Advantage plan?
Now that I'm not sure. I have the booklet, but unfortunately I have not had time to read it.
Which illustrates how confusing it is
Yeah.
and how much there is to sift through.
Traditional Medicare will not have PPOs, HMOs.
No.
They have no restrictions on the providers. You just go to someone that accepts Medicare patients, and that's the end. So in that respect, it's elegant simplicity.
Except that not everybody will accept Medicare.
That's true. You will find some, but would you say, Dr. Ash, that many physicians accept Medicare?
Most of all large organizations do, and not every doctor does, but 95% of them.
95%, pretty good.
I mean, so it's generally exempted.
Antonio.
Yeah, I was gonna say I've seen commercials of TV on the Medicare Advantage plans when they advertise on TV. But I don't know how true it is if it's high deductible, low deductible. But it says no co-pays as far as I can see from the television.
So in the article, they talked about how they predict that from 28% of the people that were on Medicare, it'll be up to 37% in the next year or so, which is a lot. That's a 9% increase, I guess. And so next, I guess we can go into, we've already been talking about why it is so good. It offers, no co-pays, no out-of-pocket costs. And then also they offer like gym clubs and some drug benefits and things like that. So it sounds really good, but maybe I think it's actually too good to be true. So.
Well, I did have the gym club, home medical evaluation, and I'm not sure about the drug benefits. I will say this: my copay for my prescriptions were not very high.
Not very high.
Okay, I can come at that. My mom just passed last year, and she was on traditional Medicare, and her drug copays were $8 a pop, and her ambulance trip was $100, and her hospital stays totaled $400. So it's like there were very, very modest costs associated with her first and last illness. She'd never been sick.
Never been sick.
So I'm experiencing that firsthand. Now, she may have been on a combination Medicare and Medicaid. Is that possible? I mean, if her income level is like that, which may account for the low hospitalization costs and the other things. But all that she presented ever was a Medicare card. So
So if we move to the next page, page 2, we can kind of get into what is wrong with the Medicare Advantage plans. And basically, you get all of these really good benefits until you're seriously ill, and then you can't find a doctor that will accept your Medicare Advantage, the specialist that you'll need. And then also, once you need to transition to Medicare and you need any extra coverage, it's harder to get that coverage, which I'll talk about a little bit more in a minute. And then,
excuse me, did you mean if you transition back to Medicare? If you leave
yes,
the Advantage
if you leave
plan?
the Advantage
Yeah,
and
there's
transition back to
some
Medicare.
Problem there, isn't there?
And so I put this chart up of the next one. It shows how many people are transitioning. On the left is the people that are transitioning to Medicare Advantage, or no, transitioning to traditional Medicare. Is it switched? The people who are transitioning are on, this is what it's showing, is the people who are transitioning. So the people who are in the Medicare Advantage show a really high bar because they're all moving from Medicare Advantage to traditional Medicare. And then on the next slide, it shows how many, when they asked people why they needed to switch, it said that 27% of them said that it's because they can't find a provider. Anybody have any experience with that, or known someone that's switched from Medicare Advantage to Medicare? Any thoughts on that? No.
I don't have experience particularly with people switching because of not being able to provide it. It's not an uncommon thing at all that you have trouble finding a provider. And I'm not sure that the Medicare Advantage is worse than the general world as far as that's concerned. I don't know. I haven't seen articles about that.
About not being, well, I have several friends who have said that they had a provider who was retiring and how hard it was to find another Medicare provider. But eventually they probably did, but that's just hearsay.
People, we see a lot of people's consultations in geriatric clinic, and very commonly, well, certainly, obviously, if they're out of town, but people in town too, they want a primary care doctor. And they have trouble finding people.
Right.
But,
I have no problem keeping my doctors a specialist.
From the Medicare Advantage to the PPO?
Well, now, I don't know about the PPO yet.
Oh, okay.
Medicare Advantage, I had no problem keeping.
Did you, and you started with regular Medicare, right? And then went to Medicare Advantage? Or you went from your old insurance, a private insurance?
It went from PPO to Advantage and then back to PPO.
Oh, okay. Well, okay.
Yeah. Well,
any other comments on
we know a fair amount
transitioning?
about healthcare.
And then also the other problem is I found that if you're really sick and you can't find a provider and you need to switch back to the regular Medicare, and in my research it said that most private insurers aren't required to sell you this Medigap, which is an extra insurance that you may need if you're really sick after you leave the Medicare Advantage for up to a year. And then even if you do need that Medigap, you may have to wait 6 months for that Medigap if you have a pre-existing condition. Any thoughts on that? Basically, when you need the health insurance the most, you may have to wait a long time to get it.
So does that mean that if you were, for example, on an Anthem Advantage plan and you left it and you went back to traditional Medicare, but because you were really sick, you needed something supplemental?
They call it a Medigap.
Yeah, and you couldn't buy it from Anthem. Could you buy it from another company?
It's a government product.
Oh, it's
isn't
a government.
It? Isn't the
rule?
Medigap
Medigap?
insurance?
I saw that it was private.
It's a part of the traditional Medicare program, right?
But
Well,
it's
like-
private. It's private.
Huh.
It's maybe regulated by
It is.
Medicare,
Yeah.
but it's
Get
a
it through
private
Medicare.
additional insurance that you purchase.
Right.
I have the
Well-
one through United Healthcare, which is under AARP.
Well, and I have traditional Medicare plus Anthem Medigap.
Okay, so
But
you're
I'm
going to
gonna-
get a Medigap if you are on traditional.
Well, I felt
Medicare.
that I
But-
needed to, but
Yeah.
maybe I didn't. But
They
I
don't
thought
have
I
to.
would.
If you've been in an Advantage plan, they
Yeah.
don't have to sell it to
I get
you.
it.
Uh-huh.
Yeah.
And they
Yeah,
don't
okay.
have
I
to-
never been
To
in.
do it, cover a pre-existing condition.
Right.
That's a
Right.
part of the rules.
Right.
So.
That's fair.
Oh, now, if you said some doctors don't accept their insurance, or you said some doctors, or what?
Yeah,
what-
basically, when you really need this insurance, if you're sick, you may not be able to get it because of the regulations that are involved with this plan.
I think we need to work on that. They need to accept the
That's
insurance.
right.
They need to accept that insurance.
That's
That's
right.
right.
Because if they don't, that's why these people are, I can't even say those words, but that's why we'll lose kind of empty out people.
Mm-hmm.
But so we need to work on that. They need to accept their insurance.
Mm-hmm.
If that's all the insurance they have.
Mm-hmm. So, which is a perfect transition to the next page, page 3. Basically, so when we look at the Medicare Advantage plan, the overall goal of it is to increase the profit and not to better health of these people over 65, because they're basically taking this big pool of people over 65 and splitting it into people that are healthier, which usually are people that are wealthier and that can pay co-payments, but are in a separate pool that they can make profits off of, which leads to the next slide, which they are talking about how Medicare Advantage plans traditional Medicare will pay more for sicker patients, which they show this in the chart where they're offering free screening echocardiograms, which most people don't really need an echocardiogram, but for a person who gets that echocardiogram done, they'll give the traditional Medicare will pay Medicare Advantage $4,000 more for that patient.
You're kidding.
That's what I found.
It shows how the incentives are changed.
Mm-hmm.
Normally you do an echocardiogram because someone has a heart murmur, they have symptoms. And the pool of people who are diagnosed without everybody getting an echocardiogram with heart failure are sicker. They're going to end up in the hospital more. The pool of people who walked in and felt fine, and the echocardiogram showed a little bit of heart failure, is not the same group. But they're getting, paid extra for finance. That's why they're doing it, and also why they do more sophisticated check for diabetic neuropathy testing.
Mm-hmm.
Now, checking for diabetic neuropathy is probably a really good thing, but the incentives are if you diagnose it and the person hadn't noticed it,
And they didn't know they had it.
they didn't know they had it, well, then you get paid extra because they've got another
How
risk
interesting.
factor, so to speak.
Didn't know about that.
And then, as you see on the next slide, it talks about it shows some ads for get your free screening echocardium today, which is kind of ridiculous. It's not okay. And then moving on to the actual payment, from what I found, this chart shows how much that traditional Medicare overpays Medicare Advantage, which is basically the government taking money to overpay the private insurance companies. And they estimate that the total overpayment between 2008 and 2016 was $174 billion.
What a catastrophe.
Wow.
Which begs the question as to why is CMS pushing
Yeah.
Medicare Advantage plans?
Mm-hmm.
Yeah, 'cause it's the
Campaign
taxpayer-
contributions. Just a guess.
Taxpayers are
Do you
paying.
think they would do that?
That's also,
So certainly,
Trump has appointed Fox as to guard the hen house.
Yeah.
When it comes to government agencies, the acts he has appointed to run government agencies are all ex-lobbyists and corporate dogs.
We have some people that just want to privatize all of Medicare. And, this works in that direction
Yes.
of undercutting the traditional Medicare
Mhm.
and promoting the privatized plans.
Keeps the insurance companies in the ballgame.
Yeah. And then, so the next page is showing what the overhead, traditional overhead looks like of Medicare versus all these other private health insurance plans, and how much more efficient we would be if we had a single payer, an improved Medicare for all, where we wouldn't be trying to make a profit as much as other private plans. Anyone have any comments?
Wow, look at that.
Isn't that something?
1.4%
Administrative.
administrative costs for traditional Medicare.
Aetna's 19%, WellPoint 18, United Healthcare 18.7, Humana 15.9.
Yeah, well, even, we used to say traditional Medicare overhead ran between 2 and 4%. This is just 1.4.
Yeah, well, you see, usually they give us a figure that includes the Medicare Advantage as well, which is a higher administrative cost. So the whole Medicare
if you average all of
is
these
higher.
out.
This is just traditional.
Mm-hmm.
Well,
That says it all.
did you already talk about the fact that companies are pushing a lot of their people onto Advantage plans?
Oh my goodness.
Because I just posted that on Facebook.
Companies, you mean?
Companies and also community, what do you call it, local governments.
Government bodies are, if they had a retiree health
Oh, okay.
plan, then they get a deal if they take their whole group of, say, state employees or whatever group of employees into a Medicare Advantage plan. They owe these people health coverage through, promises made during employment. And so those people get it put into Medicare Advantage plans without a say. In
Well,
other
that's
words,
like
their employer or their former employer is making that decision for them. So that's part of why it's going up to 37%.
See, that was my case, because that's what I was in.
Really?
I was a retired government employee.
Right, and the
And you-
teachers are in it.
You
The
didn't get
teachers
to
do it too.
choose, right?
Yeah.
The teachers do it too.
They're in it now.
Yeah.
Yeah, all retired teachers.
When did that start?
Maybe 4 years ago or so.
Hmm.
Yeah, I think it was a little longer than that.
Longer ago than that.
And I had a quick question. Since the healthcare and everything else is taking place, since the government's been closed down, would that affect the healthcare as well?
Are the is CMS closed? I don't know.
I
Are
don't
the Medicare,
know.
Medicaid offices? I don't know what is closed at this
Right
point.
now, it's been, the government's been closed for 27
Yeah.
days. That's almost a whole month.
That's terrible.
That's why I was thinking, would it affect the healthcare system?
I'm sure it affects the people being able to manage their complicated health care. I'm sure it's harder to find someone to help them figure it out. Does anyone else have any more comments about? Basically, we need single payer because it puts everyone in one pool together, and there's no dividing it up and making it more complicated for everyone to get care. Any questions?
The basic trouble is Medicare Advantage is the idea of privatizing is control costs. We control costs by rules, limiting healthcare. Sometimes staying out of the hospital, limiting healthcare costs is great, but you still have the whole overhead, and now we don't have money to do everything that we could.
That's
You
right.
know, in Medicare for all, it's a completely different model.
Right. So they claim it's controlling costs.
But it
But it's
doesn't at all.
if it's controlling them, it's by
The other part is,
cutting.
look at, why are all these people signing up? Well, they're looking for those kind of things that, Medicare for all would do. no deductibles,
Mm-hmm.
you know,
Yeah.
low overhead costs, you don't have to pay this monthly insurance fee. Would, you know, single payer would obviously solve all those problems. There's a big drive for that. I mean, a lot of people are looking for that.
Mm-hmm.
Right, and you know, these insurance companies like Humana, almost all of their revenue and profit now comes from government programs. It's no longer them out there selling individuals insurance.
They're on the
Their
dole.
big money is
Oh.
the federal programs, the TRICARE, the Medicare Advantage, and I don't know if Humana does Medicaid as well. All of these privatized programs where it's our government money that goes through the private coffers before we get any payout in terms of health care.
There was just some thing that said Humana, some Humana spokesperson talked about how they're interested in finding out more about Medicaid and Medicare and those dual eligibles, that kind of thing. So Humana's trying to get there, if they're not already, have their foot in that. But I really like what Dr. S just said, and I would like us all to remember it. Why do people sign up for Medicare Advantage? Because they think they're getting no premiums, no deductibles, no co-pays. They think they're getting choice of doctor, which they're not. But all of those are things that people want from single payer. And if they got single payer instead of Medicare Advantage, everybody'd be covered and all costs would be lowered. It's just a really good way of framing it, I think.
And not to mention the burden that's lifted from the healthcare providers by having to navigate all of these different insurance companies and all
Right.
their forms and all their requirements and being on the phone with them and all that stuff at the source of stress and burnout for physicians.
Right.
Yeah.
Is there any advantage to physicians for being on Medicare Advantage? Not being on it, but taking it,
Accepting it,
accepting it.
good question, I don't know.
Well, they get paid $4,000 more, is it?
If they
Well,
do
not-
an
not-
echocardiogram.
Not the physicians, but the Advantage plan will be paid more. The private insurance will be paid more, not the physician.
Not the
Well,
physician.
Not that I know of that I don't know if they get more. I don't think they get more.
Yeah, like
Well, they
with-
get to perform the procedure,
Yeah, yeah,
so they get paid for that.
yeah.
But I mean, would they ever say to a patient, why don't you get Medicare Advantage?
Mm.
Probably
I
not,
don't think so.
but I don't know why.
I don't think the doctors are pushing it. It's CMS that's pushing it.
It also makes you wonder if you sign up for Medicare Advantage, do you have a document that tells you what you're gonna get?
Mm-hmm.
Yeah, but try reading it if you're not an attorney.
Okay, so they're basically screwing the patient.
Mm-hmm.
They don't know until they get sick. And guess what? When they get sick, they jump ship.
Well,
And that's documented by the reporters. So we don't know, in our room, we don't have a personal experience of that. But whoever wrote these are peer-reviewed articles or whatever that have documented that statistically it's significant that people who are on Medicare Advantage that suffer a health crisis leave it. So what does that tell you? Their needs aren't met at that moment.
All right.
Single payer is the solution.
thank you very much.
All right. Thank you, everyone, for joining us
Thank you, Sarah.
online.
Thank you.
Great job, Sarah.